Alright everyone, we're going to spend one last video on back pain, and we're going to finish on a sensitive topic, which is pinched nerves. Now a pinched nerve can have a lot of different definitions, honestly, because what's pinching it really matters. Nerves act relatively the same regardless of what's pinching them, because they don't like to move. They have a finite length. So if we stretch them too much, you begin to interrupt how it can perform, which results in some of the symptoms that we commonly associate with nerves. Zinging pain, numbness, tingling, and sometimes loss of strength. Think of it kind of like when you hit the funny bone, which you may know is actually one of the more superficial nerves that crosses in and feeds into your hand. So, deciding what's pinching it can be very important. So our goal here, regardless of what the pressure is to alleviate it. So your care providers are always going to try and figure out, where is this coming from? If I tighten a muscle and the nerve area below it gets very aggravated, that's probably an abnormal sign, an indication that the muscle is probably contributing to our nerve issue. Now maybe the muscle's weak and has gotten tight. Maybe I slept or sat too long in a strange position and that irritated the nerve. Surrounding muscle might tighten up to protect something, which would irritate it more, result in a rather painful cycle where the more irritated I get, the longer I stay tight. Similarly, a muscle strain, we are going to try and treat this nerve with relaxation techniques, modalities, stretches, and light exercise to try and get it to move a little bit more normally so we can calm it down. Now on the other hand, I might try to move a spinal segment during my exam and find that that causes some of our issues. I'm going to suspect that this segment is probably part of the problem, whether it's from the disc or ligament tightness or sometimes even from a bony abnormality like bone spurs. Again, we're going to try and treat that area causing the pinch to try and loosen it up and see if we can get the nerve to glide and slide more freely like it's supposed to. In order to assist that, whether we're talking about muscle, ligament, nerve, or disc, often I'm going to give you exercises like nerve glides or nerve tensioners. These exercises are tried to help tug at the nerve, sliding it back and forth slightly, similar when you floss your teeth. The idea here is that if we slowly move a nerve back and forth, eventually we might be able to loosen it enough that it can slide freely within whatever has caught it up, which might help oscillating back and forth free us in general. Now, nerves in general are not always alone. You'll usually see them accompanied by something like that bony abnormality, like our muscle issues. So usually we're not going to just treat the nerve. Often to treat the nerve, I have to treat something else entirely. But what you'll notice if you do have a pinched nerve issue is often you'll feel numbness, tingling, or burning running down a very specific pattern. And thankfully, we've been able to map out a lot of the nerves in the human body to be able to tell, usually, generally, where it's coming from. But 4 videos into back pain, you've learned a lot, and we still have only scratched the surface. So something that we can always remember here is that when you're treating back injuries, we shouldn't always expect a quick fix necessarily. Usually, if there's multiple compound issues, we have to be able to address each one separately. And even if we're lucky enough to have it be one issue, sometimes it can be serious enough that it takes a long time. So a very important thing to work on in therapy is our patience. It's very hard to do, but with pain, it should decrease over time. And the great news is there's a lot that we can do about it to affect this back pain. So if as you're going through these videos, multiple things sound like you, it might be because your symptoms have multiple causes, and that's okay. The important thing here is just making sure we get you taken care of. Have a great day, and again, please forward us any questions you have. If you have anything more personal you'd like to come in for an exam for, obviously you are more than welcome to come in and see me. Have a great day.